We're very privileged to have Prof. Jamal back here. He is very much an alumnus of UNUI-IGH, having worked here for quite a few years. He is the usual model of retirement. People all are people who say they're retiring and then end up working much harder than they did when they were in full-time employment. And he continues to shine the light on the importance of environmental health, which is much more in the public eye now, again, because of the link to climate change and to planetary health. So today's not about me, it's about Prof. Jamal. So please join me with a warm welcome to Prof. Jamal.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning to everyone. Thank you, Professor Pascal, Elote, and also the rest of the team at UNU-IGH for inviting me back to this wonderful place. I was here from 2007 to 2008 to 2017, 1 year after UNU-IGH was established in 2007. And I'm glad to see that this institute is growing. I see many new faces, only a few familiar faces. So that shows that this place is progressing well, and I mean it's in its 12th year now. Yeah? So again, good to be back. And thank you for inviting me to talk on this issue of environmental health, which is very close to my heart. And I will try to relate it with, the SDG, as you know, the Sustainable Development Goal that is becoming the overriding issues globally, especially at the UN. Okay. Currently, I'm a visiting professor at Universiti Selangor, and I also run my own consultancy services through a small company that I set up. Okay, so let's begin this morning talk. So basically, I'll be talking about the impact of the environment on health, starting with that. And then revisiting the SDG, Sustainable Development Goal, what are the goals and how does it relate to environmental health in particular. How do we assess the risk and impact of health from environment, from activities in the environment, and what are the tools that we can use that are available out there. Two, I think, overarching issues that relate to environmental health that applies globally has to be environmental health, urban environmental health, urban health issue, and the other one is climate change. So these are the phenomena that's sweeping through the world, and it's changing the way we live, the way we work. The way we will survive into the future. So I think it's important to look at these two issues if we talk about environmental health. And specifically, I'll be discussing some of the SDG from my work previously here and after I left. So the SDG 3, 6, 11, 12, and 13. Okay. Now this is the overall scenario of how the environment can impact our health. One thing about the environment, it covers everything under the sun. So activities that happen in the environment will have impact on health. We have air pollution, we have water, sanitation, chemicals that are being used in our workplaces and industries, radiation, community noise, occupational risk, agricultural activities, pesticides, built environment, urban system with its urban heat island, and so on, and climate change. Okay? So there are many factors in the environment which can impact upon human health, creating morbidity and mortality. But what is alarming, according to the WHO, they estimated almost a quarter of global deaths, 12.6 million, 12.6 million of global deaths can be attributable to environmental factors directly or indirectly. You can see the major impact will come from air pollution. 3.3 million deaths from outdoor and 4.3 million deaths from indoor air pollution. So that's where the major deaths are coming from. And at one time they estimated half of this occurs in China, because you know how bad the air pollution there, but it has improved a lot now, but still a contributing factor. And if you look at our region of the world, 3.8 million from the Southeast Asia region, and 3.5 million from the Western Pacific region. So a major portion of the deaths actually come from our part of the world. Maybe it's also due to the fact that air pollution is also not very good in our part of the world. So we come to the issue of sustainable development. It is not a new concern, because since the Brundtland report, we have already been talking about sustainable development. Basically, it's the development that meets the need of the present, without compromising the ability of future generation to meet their own needs. So simply, we're just thinking about the future generation, how they will survive, and what we do now will impact upon their future, and the way they live in the future. And one of this is obviously climate change. So, in talking about sustainable development, I think we have to look at the interface between the three important components of development. Maybe the biggest focus now to government everywhere is the economic growth. Dollars and cents. That's what matters. Even to the ordinary people, when they don't get a job, they get very upset. So, employment rate, GDP, GNP, that is the big picture supposedly. But economic development will impinge upon the environment. And if we don't take care of the environment, this economic development will not be viable. Not be viable. So you have to balance development and economic preservation. Then there is also the human component, the social component, which interact with the environment and economic development. It has to be equitable. So many economic system whereby 5% of the population own most of the wealth. So that's not equitable, right? And if we look at the interface between all these three components, then we will find the right formula. I don't think we have, but that's what we are heading to. Sustainable development is a balance between economic development, social welfare, preservation, and also environmental preservation. So it is a very ambitious goal, but I don't think it is impossible. So that is why I think the UN came up with the SDG, in September 2015. 193 member states subscribed to this or adopted the 2030 agenda for sustainable development, with its 17 sustainable development goals. And it requires not just countries but also NGOs, companies and investors are all needed to help achieve the 17 SDG. About 3 months ago, I was called by the Bank Pembangunan or Development Bank, because they were given $1 billion of money to spend on sustainable development project. So they wanted to know what kind of project would fit this description. Of course, the banking industry has also developed what is called responsible investing. So there are guidelines that they can use. And this is not cheap. I mean, SDG, if you look at the UNTAC estimate, meeting the SDG will require 5 trillion to 7 trillion in investment per year. But how much are we spending? We are probably spending no more than 1 trillion per year. So, of course, even to maintain sustainable development, you need money. So, not to say that economic activity is not important. It is important, but we have to spend it in the right places and right manner. So, here are I think you are all familiar with it. I'm sure you've heard of this before, the 17 SDG. I circle a number of them just to highlight where environmental health, public health and environmental health will have a role to play. Good health, well-being, clean water, sanitation. So I'll give you a few examples of the work that we did when I was with the UNIDH and also before that. For affordable and clean energy, sustainable cities, responsible consumption and production, climate change, climate action, life below water, life on land, and so on. So there are a lot on the plate that we need to do, and I don't think we have the resources, especially in Malaysia. So we need to mobilize. Not only people in environmental health, but also the whole scientific and administrative capacity to help us achieve this. So there are as I mentioned, there are 169 targets. So for example, for goal 13, we have the targets and the indicator. Some of the targets are now more realistic. For example, for climate change, it says here, strengthen resilient and adaptive capacity to climate-related hazards and natural disasters. I think we've come to realize that climate change is happening, is coming, or it's already here. Actually, it's not coming; it's already here, and I don't think there's opportunity to reverse it, maybe to slow it down, but not to reverse it. But what we need is to develop adaptive and resilient capability to withstand the coming of the. So these are the targets, and you can see the indicators for the number of countries with national and local disaster reduction strategies. For example, Malaysia 2 years ago, I think, or 1 year ago, we established NADMA, National Disaster Management Agency, just to look at the disaster-related happening and also including climate change. So with this environmental threat, comes environmental risk. And we not only need to assess risk at present, but also risk in the future. For example, when we talk about climate change, it's risk in the future. Yeah? And science allows us to do this, yeah? To describe the nature and establish the probability and severity of health risk. I think when we talk about risk, there's two components that we have to grapple with. That is the likelihood or probability of the risk happening, and if it happens, what is the rate of severity? Yeah? And we cannot eliminate risk. Yeah? We cannot bring down risk to zero. For example, risk from air pollution, it will always be there. Yeah? But we can minimize it to the lowest possible, to a level which we think is acceptable. So we need to define what is acceptable risk in our risk minimization effort. And risk exposure, risk is a function of hazard and exposure. Okay? So you have to have the hazard, for example, air pollution, and you have to have the exposure population or population at risk, which in this case would be people living around industrial area or urban dwellers. And you can minimize risk by eliminating the hazard or minimizing exposure. So most of the time we cannot eliminate hazard, so we minimize exposure to reduce risk. And exposure is a function of dose and duration. So if we cannot eliminate exposure, we either reduce the dose by prescribing standard for air, water, and food, for example, and also the duration of exposure. And some of these environmental hazard has what we call a threshold. That means below that threshold, we will not experience risk. But there are chemicals that are cancer-causing or carcinogenic, where you cannot prescribe a threshold. So any level of carcinogen in the environment will translate into some level of cancer risk. Okay. We were tasked, I head this thematic working group 10 on environmental health expert under the National Environmental Health Action Plan. And we were wondering, there's so many environmental health issues in the country. How can we prioritize them? So we conducted focus group discussion, and we gathered 20 professionals and administrators who are related to the field of environmental health. They may not be specifically trained in environmental health, but they do work related to environmental health. We run 2 SDGs to ask them to prioritize a list of environmental health issues, and this is what they come up with. We ask them to rank these issues in terms of magnitude and severity. Magnitude and severity, and we score the magnitude and severity. So some environmental health issues are more widespread, but the severity is low. There are some that, for example, industrial accident, industrial disasters, for example, the Sungai Kim has a low magnitude, but if it occurs, high severity. So from this ranking, this is what they came up with. Children environmental health. I think if you go to conferences, environmental health conferences worldwide, you will see the focus now is on children environmental health. That is also part of the SDG. to look at our future rather than us. I'm 62 now, so I'm towards the end. I'm more concerned about not myself but our children and grandchildren. Vector-borne diseases, as you know, malaria, dengue. Malaria is not so bad, only certain places in Malaysia like Sabah, but dengue is everywhere. Contamination of drinking water sources. Recently we heard about the Batik community, although it has been diagnosed as measles outbreak, but the community is complaining about the contamination of the drinking water from the mining and plantation activities. And I will show you the contamination of arsenic in Cambodia and in Sungai Lu in Perak. Urban health issue, climate change, food safety and contamination. Although it has improved a lot, but still food safety is a concern in Malaysia. Pesticide contamination, human exposure to environmental chemicals, the Sungai Kinkin incident. Zoonotic diseases is making a comeback. So this is part of, when I say malaria is on the control, but it is also showing its ugly head again. This Plasmodium knowlesi, which is believed to be transmitted by the intermediate host in the long-tail macaque. It is becoming more prominent as compared to Plasmodium vivax, Plasmodium falciparum. So this one is becoming more prominent. Exposure to ionizing and non-ionizing radiation. So these are what we call the top 10, and these are the rest of the environmental health issue in Malaysia. That are also important, but maybe not the top in terms of ranking. Air pollution, policy impact of health. We have done a lot about individual environmental health issue, but we have not looked at the policy issue and how policy impact environmental health. Disaster risk, health threat from mining, contaminated site, and non-point pollution sources. Point sources are easily controlled, but urban runoff, for example, that is non-point sources. Nobody is actually in charge of that. So, looking at health risk, we need to also assess the health impact, or HIA we call it, health impact assessment, which is the process of estimating the potential impact of a chemical, biological, physical or social agent. So these are the agents in the environment which relate to health on a specified human population system, what we call population at risk, under a specific set of conditions and a certain time frame. So this is more focused health impact assessment on a particular community. So we do a lot of this when we assess a development project. For example, you want to build a thermal power plant, you need to assess the potential impact of that power plant in terms of air pollution or whatnot on the immediate community. So we ask the question like, who are the population at risk, what are the hazards, and what are the dose and duration of exposure. Okay, so this is something I came up recently to put everything in one slide. It looks very busy, but it helped us to understand the bigger picture. So when we do risk and impact assessment in environmental health, we start with the source, or the origin, the hazard. And sometimes we grapple with determining the hazard. For example, the Sungai Kinkin, you remember, for a long time, we couldn't figure out what chemical it was. And even in this recent Batik community, they were trying hard to actually know it's the infection, but finally they got it, it's measles. But is it measles alone? Is it because when I look at into the literature, measles doesn't really cause a death. Of course, those under 5 and above 20 years old are more at risk. Yeah, those unvaccinated, of course, but it's also among those who are malnourished and immunocompromised. Yeah? And there are chemicals, for example, lead, for example, or chemical related to explosive, yeah, which can suppress human immunity. So it can be a combination of factors. So there is some, some probably, when they say that their drinking water is polluted, we cannot just simply dismiss it. Okay? So source hazard. So we need to identify the hazard, whether physical, chemical, biological, psychosocial, and then we look at the exposure, how people are exposed, the route of exposure, frequency, whether it's through inhalation, injection, direct contact, and the dose and duration of exposure, which will translate into risk. And in estimating risk, we can do either qualitative or quantitative. I'll show you some example of this. And we look at cancer risk and non-cancer risk. We can use the risk metric, and then we have to identify the population at risk, who are those that are directly exposed to the risk, and then the health risk, the outcome in terms of acute and chronic risk, and only then we can mobilize effort to try and minimize risk, risk minimization, looking back at exposure and hazard. So you have to go through this diagram and process to understand risk and how to act on it. And we were engaged by Ministry of Health to come up with a simple risk assessment metric, which is called Environmental Health Risk Inventory Metric, where they wanted to do a thorough assessment of the whole country. So we worked this with the engineering division of the Ministry of Health, where we devised a mechanism to inventorize all the sources. Okay? So can be, for example, landfill, sanitary landfill and illegal landfill, sewage treatment system, chemical industries, agricultural practices, plantation, animal husbandry, and so on. So, once we have this inventory, then we look at the hazard that comes from that source in terms of its probability and severity. So we do a hazard rating, and then for each sub-district or mukim, we do what is called an exposure rating. So that exposure rating for that locality or mukim will be associated with population density. The more dense the population in that area, the higher the exposure rating. And what are the human receptors that are present in that locality? For example, educational institution, hospital, recreational areas, school, residential area, and so on. And by multiplying the hazard and the exposure rating, we get the risk rating. Okay? We can come up with a map such as this. We ran a pilot study in 3 states, Perak, Melaka, and Sabah. Yeah, Perak, Melaka, and Sabah. One small state, one average state, one huge state like Sabah. So this is not finalized yet, but we use a percentile cutoff to determine the risk level. So you can see here, this is for the state of Perak. Yeah? You can see here the district of Batang Padang with a lot of this. Each dot represent a hazard or a receptor point. For example, tapak pelupusan sampah and tapak pelupusan sampah harap. This is legal dump site, illegal dump site. This is factory. So you can see Hulu Perak with very small number of sources and hazards is in the very low category, while Batang Padang and Krian are in the high. So we hope a simple tool like this will enable the administrator, whether they are health administrator or environmental administrator, to monitor their state, their mukim, to know the sources of hazard and the hazard. And we have finished our part. Now the Minister of Health is engaging with the remote sensing agency to digitize, that, to put it on a map, so the local counterpart will key in the GPS location and the rating and whatnot, and it will be compiled at the federal level and should be accessible to drink water, but you can use it for other purposes. So in one district, in the Kandal district, the prevalence of arsenicosis and skin cancer was quite high. So we did a number of studies. Some of these were published, for example here in Science Total Environment, to look at the most reliable indicator. And we found that hair, so different heavy metal have different good biological indicator, but because arsenic is so cumulative, hair arsenic is the good indicator, and we believe that 1 microgram per gram is the cutoff point to determine between health effect and non-health effect. So these are the skin lesion, hyperkeratosis, hypomelanosis, are very, very much associated with hair lab. And we also did some other studies that look at arsenic that are very, very low, that do not show all this skin manifestation, but already affecting the children's academic performance, because arsenic is also like lead. It affects the central nervous system. And we also did cancer risk assessment, because we noticed that the Cambodian government were not too serious about this arsenic issue, because they say, there are cases of skin lesion, cancer, but they are sporadic and very localized. Not knowing that if this may be the beginning, because it takes about 10 to 15 years for things like skin cancer to. So we feel that we have to show them a bit about the future. What may happen if they don't take action right now. So we did one study we published in Water Research to look at cancer risk probability. So this is the internationally acceptable 1 in 10,000. Anything above 1 in 10,000 is considered as unacceptable. That means if you expose 10,000 people, 1 in a lifetime will get cancer. You look at this Kandal, almost everybody, will likely, be getting 100% of the people there, especially experience risk of greater than 1 in 10,000. Hisham is the cleanest, so not the whole of Cambodia, but selected area in Cambodia. And then we gather everybody, all the people, all the stakeholders, and all the players like WHO, UNICEF, and UNIDH at that time, and we call the government agency, the health ministry, the Ministry of Rural Development. We presented all this evidence, not just from the UNIDH, but also from WHO, UNICEF, and I think finally we managed to convince the government the impending threat, the impending threat. Because if they just look at what is happening, they don't see much. Because Cambodia is a young country after Pol Pot era, and not a young. They have the more history and all that, but developed Cambodia is relatively new. And I thought we did try to look at arsenic in Malaysia, because we know that tin and arsenic coexist. Tin and arsenic coexist naturally. In fact, the miners, when they want to scout for mineral, to survey for mineral, if they want to look for tin, they rather look for arsenic, because it's easier to find arsenic. If they find arsenic, then they know it's tin down there. So logically, you will know that. But somehow, we did a few studies here and there, but we couldn't see an area that was contaminated with arsenic until this issue that was uncovered in the northern part of Perak, called Ulu Perak, where there are a number of tin mining concessionaires, and we have downstream. So we have the tin mining being done upstream, and downstream we have the water treatment plant. And one treatment plant is severely affected. That is the Lohit Air Ganda, where they found arsenic level not as bad as Cambodia, but above the WHO level. So finally the water treatment plant was shut down, and we just completed a social survey, a medical and health survey of the area to look at the potential impact of arsenic on the population. Next, I want to show you, because this is related to responsible consumption and production. So you can see here the Sungai Kim Kim, toxic waste dumping incident. Anybody here from Johor? Johor Bahru? You're from Johor. Are you from Johor Bahru?
No, I'm from that place.
Oh, you're from?
My house is just near this.
Oh, okay. We have real life document here. So what happened is that there was illegal dumping of chemical waste from an industry, and initially it was water pollution, but it evolved into an air pollution. So in a way that was a bit unprecedented. Usually water pollution remains water pollution, but now the severity is so great that whatever they dump volatilize and create a new different threat altogether. And there was a combined meteorological impact as well. Heavy rain followed by warm temperature, which maybe the water also react with chemical, and the chemical itself react with each other, and the warm temperature will probably improve on the volatilization and transport. And what was clear to us is that children were more affected than adults, because of their immature respiratory system and their higher metabolic rate, for example. And what was a bit puzzling was some nearby residential areas were not affected. So this has a lot to do with the wind pattern, where the wind was blowing. And slow horizontal downwind transportation of air pollutant probably played a significant role. So these occur in highly populated residential area close to the industrial zone. So This is where they dump the toxic chemical at a bridge which is under construction around slightly after midnight. When I interviewed some resident in Pasar Berarah here, there was some small village here. They mentioned that they were awoken at about 2 a.m. Because of a very strong smell. They couldn't figure why it was. So the whole village practically was awoken, and they were looking around their house. Maybe the motorbike is leaking or whatnot. So they were thinking it's from their home, but actually it was 2 hours of travel from along the Sungai King, and close to this area are 2 schools, which were badly affected. So this is where they conveniently dump the toxic waste. You can see the color of the water. This is after the incident. I went there like 2 weeks after, and it still look like this. These are taken from the media, but this I took myself, and it was still black. And so what happened? Between 12 and 1 a.m., toxic waste was dumped. King, and 2 a.m. The people near Pasar Berarah was awakened. So the following morning, the nearby school were hit by this chemical that were carried by the air. And then they quickly mobilized river cleaning process, without good information about what has been done. So these probably are very volatile chemical. So the haphazard cleaning of the river could have contributed more to the volatilization of the chemical. So then the process was halted, and the proper cleaning company were then engaged who could handle toxic waste cleaning better. So the cleaning process was believed to have caused the chemical to react, so mixing it up, resulting in the second bout of poisoning following the 7th March on the 14th, on the 11th of March. And then there was a 3rd wave and a 4th wave, which we are still trying to understand what really happened. So the first one was 7th March, 11th March, 12th, 13th, chemical was dumped on the 6th. So it was spreading to more places, and finally they had to close 111 schools to minimize further effect. So this was the scene at some of the schools. There was panic because they don't really know what has hit them, and the authority also they know where the chemical is coming from, but how far it has traveled and what are the chemicals became a big question mark the first week of the incident. So luckily nobody died, but there were 25 people admitted to the intensive care unit. So that shows how serious the incident was, and almost 6,000 patients were treated, and among these about 950 were ordered. Finally, we had a glimpse of what the chemicals were, but later on, although it's not official, it was mentioned that some 26 chemicals were detected. They may not necessarily come from the Sungai King incident, but they could have come from the other industry as well. But that's what is present in the air of Pasir Gudang. Methane. Initially, people were talking about methane. Oh, it's methane, but it couldn't be maintained. Yeah, it couldn't be maintained. So if you understand the risk of chemical and its health effect, it couldn't be maintained. Not to say that methane is not hazardous. What methane does is it replaces oxygen. It's not toxic, it replaces oxygen. When there are too high methane in the air, you become depleted, your lung become depleted with oxygen. And it usually occurs in a confined space, in a sewer line or in a mine, when the methane build up to a level that it replaces oxygen. But here is an open air condition, so it couldn't be methane. And then later we realized that there are chemicals like acrylonitrile and acrolein, which probably did the work or whatever you saw happen with the children, because the level was way above this what we call AEGL, acute exposure guideline levels. For 1 hour. So AEGL2 is the airborne concentration of a substance above which it is predicted that the general population, including susceptible individuals, would experience irreversible or serious long-lasting health effect. So we did some risk assessment in terms of, because there was benzene, and we know that benzene is carcinogenic. Acrolein is also, acrylonitrile is also carcinogenic. But for benzene, for example, exposure at this level of benzene over 60 days would have incurred an unacceptable lifetime risk of leukemia, in excess of 1 in 10,000. So this incident has passed, but what we also need to know is there any lingering, long-lasting effect, which we will probably never see it as a Sungai Kim, or we would probably never relate it back to Sungai Kim, but if we do some risk assessment, we can know the potential. Okay. How much time I have left?
15 minutes. 15 minutes.
Not if we want questions.
Yeah, okay. I'll try to. 30, not so bad. Maybe another 5-10 minutes. Okay. The global overarching issue of environmental health. It's not just environmental health, but urbanization will have very serious environmental health implications, and we know that now more people live in urban area than in rural area. And we have this mega urban region. Used to be something that we saw in the West when I was in high school. We talk about New York City, London, huge city. Everybody wants to go to big city. But now we don't have to go very far because the big city has come to us. Manila, Jakarta, Bangkok, that. So 7 of the 10 largest mega cities are found in Asia. Tokyo, Yokohama, Jakarta, Seoul, Incheon, Delhi, and so on and so forth. And some of these cities are, for example, Tokyo, Yokohama, 37 million. My God, that's more than the whole of Malaysia. And here are the cities with at least 500,000 population or more back in 2014. So you can see Asia conquering the mega city record. And with this come our urban environmental health issues. Recently we ran a workshop, APN workshop at UNICEF, and we visited Kuala Lumpur City Hall, Dewan Bandaraya, and they were showing us the huge problem they experience with waste, domestic waste. And looking at the classification of domestic waste, 13% of domestic waste from Kuala Lumpur are diapers. Diapers alone. Diapers alone. So, that kind of issue will continue to be a problem into the future. Air pollution, indoor air pollution in home, poor mass public transport, road accident, noise pollution, substandard and overcrowded housing, sewage and waste disposal on these things. Not forgetting crime and mental health. We don't want to make it a big issue, but crime is still a problem in Kuala Lumpur. Snatching, drugs and all that. And finally, SDG 13, health impact of climate change. We have known the environmental consequences of climate change for a long time. Impact on the ecosystem, on the terrestrial and aquatic ecosystem. But we are now discovering the health consequences, the health effect. Climate change affect the social and environmental determinant of health. It impinge on our clean air, safe drinking water, food security, shelter, and so on. And that will translate to environmental health issues. And between 2030 to 2050, climate change is expected to cause 250,000 additional deaths per year, from childhood malnutrition, malaria, diarrhea, and heat stress in the elderly. Just recently, Kuwait recorded the highest sea temperature ever, 63 degrees Celsius. I can even imagine. I've been in Saudi Arabia one when it was 50 degrees Celsius, and I thought that was unbearable. 63, and it's not even summer yet. They say probably 68 is coming. So, but over in Kuwait, in the summer, everybody take holiday. But they cannot bear the heat. Direct damage cost 2.4 billion. And what is alarming is that developing countries will be the one that will experience the greatest impact due to our weak health infrastructure and our ability to cope and adapt. Okay, so this is again a diagram which I would like to show to give the overall picture of health impact of climate change. So actually, in the climate change, we not only have global warming, we also have global cooling, because pollution actually deflects sunlight and cause negative radiative pulsing or cooling. It's from the aerosol pollution. But the overall impact, the net impact, is global warming. So what happens is that this global climate change will first modify our environment, increase surface temperature, melting polar ice, altered wind pattern, extreme weather, and so on. And this modification will lead to environmental impact like drought, flooding, and finally we will have the health consequences. In terms of mainly there are communicable diseases, but they can also be non-communicable diseases like respiratory diseases. So I will close with this account of one of the worst Malaysian flood that we have ever experienced. It was in 2014, where we have more than 500,000 flood victims. 300,000 over in Kelantan alone. The number of damages, fortunately only 25. I thought there was a miracle. 25 flood related deaths, 11 in Kelantan. and close to 3 billion lost in public property, not including private property losses, has never been estimated, I guess. Yeah, because in the developed country it's easy because most people have insurance, so you can calculate that from the insurance claim. But here, like this, the old couple, yeah, they are left with the stats of their once must be beautiful house, but all wiped away. It's a very sad sight to be seeing. One of my PhD students look at the communicable diseases consequences. We look at several communicable diseases: leptospirosis, dengue, cholera, typhoid, and so on. But what stood out the most was leptospirosis. Yeah? This is bacteria transmitted by the urine of rodent. Yeah? And you can clearly see here the spike in leptospirosis. The black line, the red line is the rainfall. Yeah, the red line is the rainfall. So during the 50th and 52nd week in 2014, you have this spike in the rainfall. And in one area of Kelantan, in the mountain area Gunung Gagau, they measured a rainfall that was 77% of the annual total rainfall that fell over a duration of 1 week. 77% rainfall fell within a week. So that's why there's a lot of water. And then we can see this spike in leptospirosis, the black line. Yes. So obviously after the rainfall, the cases increased. But we were wondering why we have this peak post-rainfall, post-flooding. Okay? And it took some time for the leptospirosis to subside. Okay? Why do you think that was? What was contributing to this post-flood spike in leptospirosis? You know it's related to rat, right? And where do rats live? Where do they live? In garbage disposal area, right? Okay. So post-flooding, there were a lot of this stuff from the flood that had to be disposed quickly and haphazardly, not their fault, because suddenly there were, thousands and tons of stuff lying around that they had to dispose. So we did what we call canal analysis using GIS. So the green dots are the disposal site, and the color redness is the density of the leptospirosis cases. Okay? So you can see the leptospirosis cases were accumulating around this post-flooding disposal site. Yeah? So there are a lot more that I would like to relate to you, but in the interest of time, we have to only select a few. So this is my new team now at Unicel, a very small team, very young university. I'm trying to help them to develop environmental health there. But we did one APN project with Kyoto University and University students also from University of New South Wales was there, but with University of Otago and University of Melbourne and Cambridge University. The workshop was on incorporating health into urban planning workshop. That was my back approach. Okay, so that's briefly what I can share with you on environmental health in Malaysia and also globally. And so if you have questions, I will be glad to try and answer them.
Thank you very much. Before I open, just a couple of quick comments. Thank you very much, Prof. Jamal. Really interesting, and it's also quite interesting, I think, to try and connect things that we hear in the news to actually how they have a real impact on us. One particular point you made from your focus groups in the beginning, that was largely about the impact on children and thinking about children. I think we use children because it's an easy button to push. You talk about children and everybody holds their heart. But this is a country where you have a prime minister who's 93 years old. So these are things, I mean, you still have at least another 30 years to go. So these things that we're thinking about for the future are really a future for all of us. So we can't afford to think short term anymore. It is a long term. Absolutely, for all of us. I think another of the other points as well, I mean, the environment is everybody's business. And the way that we think about it, it's something that is very much captured by public health. But I think even within the clinical services as well, there's a lot that we need to think about in that area. I know some work that is being done in the UK, for instance, that is actually linking the Met data with hospital admissions, because that then allows us to think about how we make sure that we have the right human resources within the hospitals to cope with some of these environmental and climate events as well, to ensure that we are providing the best quality of care. So, open up for questions. Any questions? Yes.
Hello, Prof. Jamal. My name is Muhammad. I'm from International Medical University and also members of United Nations Association of Malaysia. So basically my question reflecting to two questions. The first one is when we see from your slide, it seems that the government also taking action after something already happened. And reflecting to the main thing to developing to meet up the sustainable development goal, we need to basically to take action without before or after the things that happen. So it seems that our government are actually implementing something right after the things already happened. So, based on our what we call expertise and everything on how we should manage this thing, and urge our government to done better afterwards. And the second question, reflecting about the what we call urban area. So basically urban area, based on your research on Perak, basically urban areas such as Ipoh and some districts are actually developing a high risk to the health of the people. And it seems that nowadays, most of the countries in this world are actually looking forward to increasing up their economical and also the development of the country, especially the cities. So basically, it will reflect the health risk of the people itself. So basically, the people will go out later to make sure that the health will, I would say, be good in the future. And so, how your perspective about these things and how we can be good. As a government to reflect good way to implement good cities and everything. Thank you.
Okay. Your first question about government reaction. Yeah. This is not unique to Malaysia. In most developing countries, that is the prevailing situation. But even in developed countries, so we have to. This is what environmental health risk assessment and impact assessment is about. Is looking at the potential risk. So changing our perspective from being reactive to being proactive. Yeah? But of course, that's easier said than done. There are some mechanism within our administrative capacity that has already engaged this. For example, we have the environmental impact assessment. Yeah, environmental impact assessment, where we look at the potential impact of a development project before it is being carried out. Yeah? And under the environmental impact assessment framework, we have the health impact assessment framework. Okay? But this is involves a lot of modeling. So sometimes the accuracy is in question. So that's why EIA must be complemented with an auditing process, environmental auditing. But unfortunately, while EIA is well on the way, environmental auditing is still in its infancy. So, we don't, the connecting part is not there. Okay? So, the other thing that I'm trying to impress the government is that, like for example, we do energy project, hydroelectric dam, thermal power plant. Initially, we were going to maybe do a nuclear power plant, but I think the new government for the nuclear has been shelved. So those are energy projects, but we have never assessed our energy policy. Yeah? Environmental strategic environmental assessment or even health impact assessment on our energy policy. We have to do that first actually before we do the project. So we have agricultural policy, we have energy policy, industrialization policy, national car policy, right? National car policy. And if we do a proper environmental and health risk and impact assessment on national car policy, maybe we have second thought about it. I'm not saying that it's not good, but we need to do that. We need to do that because it has a lot of implication on the way we move, the way we transport ourselves. Okay. And the second question is about sorry, I lost it. About how do we improve? Okay, yeah. SDG is about leaving no one behind, right? Yeah, leaving no one behind. And I think the batik community is an eye-opener for us, isn't it? See, this batik group, this new to me, so I start reading about them. They are the least developed of our Aborigines tribe. They are hunter-gatherer. They don't cultivate their own crop. They are not nomadic actually. It's a wrong perception. They are not nomadic. They stay put in one place, but they move into the jungle to gather food. Yeah, gather food. So what happened is that development has encroached into their area, mining, oil palm plantation. So they lost their food gathering or seeking areas. So we have that pockets of underdevelopment, in supposedly nice, beautiful Malaysia. We have the first world areas like Kuala Lumpur, Penang, which is like 100% urban, and we have the rural in between, and it's not, and the encroachment of our ecosystem, our natural system, and all that. So I think we don't have a proper national development foresight. We have this EIA, we have this structural plan, but sometimes there's structural plan, but nobody follows the plan, isn't it? Nobody follows the plan. For example, there's such a plan that never been gazetted, only on paper. When we come to implementation, Kuala Lumpur is a very nice structural plan, but yet you see, land grab happening here and there. Why is it happening? You already have the structural plan. Okay, it's never been gazetted. So, on paper it's nice, but implementation-wise we are still lacking. And we need a total commitment. Not just from the government, but also from the civil society and the community. I used to live in Bandar Toraza. I find it a very nice, serene place, very non-urban. But now, even the football field, they took over. They want to build high-rise in the football field across from the gas station. I hope they won't take Tasik, Bandar Tasik, the Maisuri Lake Garden. So I hope, I probably don't answer all your questions, but those are my thoughts on.
Yes.
Yes.
Hi, my name is Maria. I want to ask you about, you said just now that we have policies and sometimes people don't care. How can we increase that awareness and how can we educate ourselves so we can become better? Yeah, because sometimes this pollution, this all of this bad things happens because we don't care. So how can we educate ourselves better? How can we become aware of that?
I think the media is the most powerful instrument, and fortunately now we not only have the what we call mainstream official media, we have also the social media. Yeah. So actually the Batik community incident was viral in Facebook posting by one of the NGO, I think Facebook or some social media. We used to have a very environmentally friendly media at one time, in the early 90s, early 90s or late 80s, were free. Star, for example, I know that Tan Cheng Lee, very. In fact, one of my former master students was from Berita Harian, And then what changed that is actually the haze, 1997. After that there was a clamp down on the media. For example, people like us were gagged. We were not allowed to talk about air pollution and all that. And suddenly the interest in covering environmental issues died down. So and then the public was not quite made aware of the environmental issue. But fortunately, I see that reversing now. Probably because of the social media. So you don't want to publish, okay, the social media will publish. I don't want to mention one. I got one. I used to like writing to the editor, letter to the editor. So I wrote to the Star about one environmental issue, and I waited and said they don't want to publish. That time Facebook was new actually. So I said I put it in my Facebook. They said this is the letter that I sent to one mainstream English paper which they don't want to publish. So everybody wanted to read. What is that? Why did I say that they don't want to publish? So and then FMT picked it up. Everything. Some politician also picked it up. So it became news. So I think because of that, either they follow the trend or they will die natural death. Many of the newspaper already long dead and gone. But of course, sometimes is responsible reporting. It's very important. Responsible important. And So the newspaper, to sell newspaper, they have to make it more sensational. Yeah? But sometimes it's not the fault of the reporter, it's the fault of the editor. The editor that will have the final say, and they will change things. And so I know quite a bit about how the media works. But I think scientists are not media friendly. So that's why a lot of our work never gets translated, and then we are so scientifically tuned, that we only speak the language that only we understand at conferences. The word in Malay is shock sendiri. You get high on your own, so you have to relate to the public, and I think there are good civil society NGO there, that they are creating this link between science and they are got a lot, especially on climate change. I see globally there are a lot of public scientific publication, and I think climate change, the communication sector or the media sector has done a good job. Is that just the government buy-in is not there yet. But almost everybody is aware of climate change, or everybody who are exposed to the media are aware what climate change is about. But the political buy-in is a bit slow, because it involves changing the way we do business. That is the technical part.
Can I just add in a little bit?
Yeah.
Answering to your question, you said, how do you change your mindset?
Yes.
So like me and animation, for long term, they're trying very hard to change, to educate the new, maybe the young generation, so that you guys, will be maybe the future leader. Will probably change our mindset. And the second thing is that in our country, where health is concerned, we are very much into curative health. There's so many hospitals here, so we do not go into preventive health, which is very much it's cheaper and it's easier to implement it. For example, like dengue, you just clean up your cities and so on. I mean, rather than to treat the patient in the hospital. So I think there is long term of educating the public, and even in education, part of environmental health is not really, we are not given a due sort of recognition or allocation to really build up our program and so on, very much into the clinical side, So that is for long term, and perhaps in the health part, to go more for preventive. So that's my comment as an academician. Actually, we are all retired, but we can never retire because there are lots of environmental disasters, problem keep coming up, So when there are problems, then they start calling us. So I said, when am I going to retire? But of course, it's our passion to in environmental health that we feel our need to help out the country. Thank you. I'm from UBM. I'm a professor there, at the Department of Environmental and Occupational Health. We have a program there. But we only get about 50 students every year. That's very, not too many, Okay,
You have to make your message a bit sexier for the younger ones to we need to change the way we sell the courses that we run to make it
really good.
Yeah. Sorry, I did see. Yes, please.
Hi. I'm Asura. I'm from the other part of this business. You guys are the academicians, we are the responders. So we respond and respond, we get tired. It's still the same, and then we get very disappointed the news never change. We have climate, you've been hyping the climate change and stuff like that, but disaster happened, we still pick up the pieces and go. So, and what I want to find out here and suggest to the academia is that it is very difficult for us to do preparedness planning in terms of what are the capacity, what are the logistic preparedness in order to anticipate, so we get to help and send relief items and stuff correct
if we don't have all your data, your research work kept in one portal for us to have the access. Because for now it's scattered. So every time the decision wants to do estimation, we want to do what is the capacity the city stock should have in anticipating the coming disaster. We were like scratching because, and the data is scattered. So normally for the decision, we will do a yearly assessment on the anticipation of which area, agak-agak, that will be hit this year, next year, or which region. So that will help a lot in terms of planning and getting the right people, mobilizing the right asset, and making the necessary preparedness. So I suggest if we have a portal where we all can go in and have access and get your permission, if you have all this data, it would be very much appreciated. Thank you.
Can I just a quick response to that? I think that is actually one of the issues that the UN country team here through UNDP is very keen on doing, and there is some work that's been started. So before you leave, talk to me, and I'll put you in touch with the UN country team. Yeah. Yes.
Thank you, Professor Hashim. So my name is Hisham. I'm from Malaysia and formerly from UPU. Regarding the batik, the government has said that they don't believe the issues have been caused by the leaching from the nearby iron ore mining. So in your opinion, what do you think has been causing the issues?
Yeah, I've been asked by a few parties, obviously it's infection, right? And most likely it's pneumonia. But I think the autopsy report are still pending, on the 14th death. So until that is out, we probably cannot know the real cause, Probably they are all pneumonia related, and if you look into the literature, yes, pneumonia is a complication of measles, serious complication of measles, especially among the young and the older. Somehow literature say below 5 and above 20. I don't really know the rationale behind that. Yes, they are very malnourished, because their source of food has been disturbed. Yeah, they cannot. We did once. We didn't do study, but I was part of a bigger study on the Bakun, Bakun, the dam, and there were those aborigines around Bakun, Balaga town, and all that. Somebody did a nutritional survey of the community, and they come up with the main source of protein was wild boar. Wild boar. Main source of protein. Not the fish. Wild boar, And you can only have wild boar if you have a proper forest. I don't know what is the main source of protein among batik, about protein energy malnutrition will cause severe immune deficiency, and there are chemicals. I'm not saying it's the chemical. There are chemicals that can suppress the immune system, whether that contributed to the immune system suppression besides the malnutrition, is anybody's guess, So I think it's a combination of factors, and I think it would be sad if we just focus on measles, and immunization, Of course, but now it's measles. Next, it can be something else, isn't it? It can be another thing, because if you are immunocompromised,
Measles you can see on the skin. Do you see traces
it's to respiratory, right?
Respiratory.
And those skin, I think, these batik people has high rate of skin infection, most likely fungus, because that's again a sign of signs of malnutrition and immunosuppression, then you get fungal infection of the skin. Normally we don't, we don't because of skin. And it's a common thing, even from what I heard, don't take my word for it because I've never been there. From what I heard, most of them have skin infection, so fungus. And fungus can also lead to pneumonia, fungal pneumonia, which is very problematic. So these are the questions that, floating around, So it will help if we get a very detailed autopsy report on all the 40. I heard they have retrieved all the 12. So hopefully they will take their time, and let them do a good job, and get to the bottom of things because of that. And one more thing about Malaysia, I've been trying to impress our medical colleague. We have Professor Riza from Department of Community Health, who was also my former boss. Medical record, Riza, medical record, because I don't know, maybe half or slightly less than half of our cause of death, certification of the cause of death is still by the police. And I've seen how the police come and certify that. And I say, my God, they don't even touch the body, they will ask, what's he doing, what happened to him, they go back.
So sometimes he's sakit tua.
So that is very important. That is the health signal of the nation. And in many countries, like for example, this one, we have the primary cause of death. Primary cause of death. Underlying cause of death. The underlying cause of death can be 2, 3, or 4. That's how detailed it goes. Not just why you can die of measles. But why you die from measles? Why you die from measles? So this kind of thing very important, and I hope we can get on with this insisting on 100% medical certification of that. And then cancer registry is another thing that's on the way. We need to do that. So with this data, we can use, we can. I know there is the health information system underway, and we are also trying to initiate the environmental health information system. So we have information, but they are in everywhere. We have air quality monitoring. We have 65 stations. We have river water quality monitoring, sea water, groundwater. But they are here and there, and nobody is putting them together. In the big data. Now we have big data. That's what big data. Yes. So that's what we have to look into.
Okay, I think what Prof. Jamal has shown is that using the SDGs framework certainly gives us an opportunity to bring together a whole range of complexities within our environment and the impact on our health and so on. And they are actually a really good way of unifying some of these discussions. So thank you very much, Prof. Jamal. We would like to invite you all to have a Hari Raya open house lunch with us before you go. We are taking photographs. I know some people have been on social media. If any of you left work without telling your boss, please let us know so that we can, and if you have any problems with your images or any of these photographs being put out, please let us know. But otherwise, enjoy your lunch, and thank you very much for coming. Thank you.